Hi, I'm Dr. Mitzi Krockover, and this is a special bonus episode of Beyond the Paper Gown for founders, innovators, or anyone thinking about creating a digital product in women's health. Today, I'm joined again by Josefina Ruiz, Head of Growth at the healthcare product agency Lighted. In our main episode, we talked about how digital tools can shape women's health, and I highly recommend taking a listen to that enlightening conversation. In this mini episode, we're going behind the scenes, how to turn a problem into a product, what founders get wrong about tech, where AI really helps and where it doesn't, and why community and trust matter just as much as code. Thanks again, Josefina, for being with us.
Thank you for having me.
When we think about building a healthcare or femtech app, what's the process look like from idea to launch?
I always like to break the process in three parts. The first one is product discovery, and that's pre-product, pre-building, pre-code. And during product discovery, we pretty much define all the specifics about the product, the technology, and the design and user experience. For the product is deciding what features it will include, what's the roadmap, what are the different phases and different launches of the same product. On the tech side, what's the tech stack, what programming languages we're going to use, what integrations do we need. And on the design side, it's shaping the user flows and the user experience to make sure that the product actually makes sense and fits into the workflows and the life of a patient or a provider, or both, depending on the type of hub we're building. The second phase is designing and developing the product. It usually takes months to build a mobile app, for example, or a web app. And we have teams of software engineers, designers, QA engineers, DevOps, project managers, and of course the product owner, who is typically the entrepreneur or whoever owns the project, guiding the whole process. And the third step is launching, getting feedback, launching again, and it's that feedback loop in which you keep improving the product, updating it based on the feedback that the users are giving you.
Sure. I'm sure you have a number of founders who come to you that aren't technical. How do you help them translate an idea into an actual digital product?
That's a very interesting question. I think the fact that I'm not technical myself really helped, because I also struggle with it. It's very hard to understand technology. It's very complex. When working with non-technical founders, I think there are two very important things. One is having patience for us as their tech team, being very clear and explaining the technicalities and why we're making those decisions and the overall process. And the second really important piece is trust. Gain that trust so that they can focus on what they know best, which is healthcare typically, and we know what we know best, which is technology. I also think that having technical co-founders is very, very beneficial. So if I were someone with a clinical background starting a company in the tech space, I would definitely think of having a technical co-founder.
So that they really should have in-house expertise as well, is what you're saying.
It helps smooth things out. We have a lot of experience working with solo founders or fully clinical teams, and it works. But I guess the process of gaining like that trust can be a bit harder if the founders don't have any control or understanding about the technology.
Sure.
So if you have someone in-house from your team that is just like making sure that you can trust these Lighted people, that's just makes everyone's life easier.
You know, that's a really good point, because I see this through a kind of an investor and mentor to some entrepreneurs lens, because there's always this decision to be made. where am I going to spend my money, my very lean amount of money? And, maybe they've decided not to get that CTO or using more of an advisor or something like that because of the cost. And what I'm hearing you say perhaps is that it might, in the end, be more expeditious and efficient to have that person in-house, if you will, to be able to liaison with vendors like yourself.
I think both ways make sense, and we have amazing success stories working with clinical founders that had no background at all in technology, but that were also flexible enough to understand how different the products are built in tech and all the very technical decisions that you have to make. So yeah, I'd say having a CTO or a virtual CTO, tech advisor that works for you as part of your company, it just makes it easier and makes it more smooth to trust on whatever external partner you're working with, because we know we're doing a great job, but we don't want to be trying to convince you about it. We rather focus on building and on making the right decisions than on trying to convince someone about why we're making those decisions. So when you're talking the same language with a CTO, it's just better and easier to get green lights.
You often talk about product discovery as a foundational step. So what does that really involve, and why is it so critical to health tech?
So product discovery is this first phase. Founders typically come with an idea on, this is the solution I want to build. I want to build a mobile app that does this and that and that uses AI for this. Amazing, but let's step 10 steps back and focus on the problem, focus on the users, and let's leave it to the users to decide what you want to build. So let's discover it. That's the core of the product discovery. It's very influenced by design thinking and user research. It's critical because if you're building on top of assumptions, you are probably not building the right thing for the right people, and you're probably gonna lose a lot of time, and we all know that time is money, in pivoting and rebuilding and going back and forth with the technology already built. So that's a problem. We rather start with a product discovery, figure out a roadmap, start with a minimum viable product, which is the smallest product that adds value with the core value proposition, and based on how users experience your product and give feedback, you can start growing that product and making decisions in a linear way. You don't have to go with a full, incredible, massive product and then figure out that actually people don't want a mobile app. They just want an SMS notifying them of whatever action they need to take.
Makes a lot of sense. We talked a little bit about this when we spoke earlier. There's obviously a lot of hype around AI in healthcare. But from a founder's standpoint, how are you actually seeing it used in meaningful ways when building digital products? And how do you advise your clients about how and when to use AI?
Of course, there's a lot of hype with AI, and there's a problem in healthcare, which is that everyone is already using AI, even when they shouldn't be. So that's something that the healthcare industry has to figure out. In terms of startups that are popping out now, it's amazing because you get to integrate AI from day one, and it's just much easier to build an AI workflow now than it is to rebuild a workflow that wasn't built with AI, and that has a lot of manual work. And when you already have, thousands or millions of patients or providers or users. So that's the good thing about the era we're in, and the momentum of, okay, we have these amazing tools and we can build automated workflows. We can provide much more personalized experiences, and we many times don't need humans to have that human touch. Yeah.
What are some of the challenges or pitfalls that using AI introduces for the developers, and how can the founders mitigate some of those problems?
I think the fact that AI evolves so quickly and generative AI evolves so quickly is tricky itself, because whatever you build now can be obsolete in a few months, or at least that's what I'm seeing. Things are so accelerated, so that can be tricky. And I guess in healthcare we have to be hyper conscious about the advice we're giving, the data that we're providing. As a doctor, you can't give your patient's information to an AI, for example, if it's not an AI that your health system is providing you with. As a user, we're all getting healthcare advice from ChatGPT, and it's not always right. So as founders, we have to be very, very careful on what kind of information we're providing the AI and what kind of information we're providing to the final user.
How should founders bake in data privacy and compliance, and what are the kinds of things that they need to be aware of?
In terms of compliance, the most important thing is to bake it in from scratch. HIPAA compliance in healthcare shouldn't be a requirement that you add when the product is already there and you have a checkbox that is make it HIPAA compliant. It doesn't work that way. So make sure that you're building in a HIPAA compliant way from the ground up to make sure you're in control with, and have those security and privacy policies in-house. So it doesn't matter how private and secure your app is if you're leaving your computer open at your WeWork and with all your patients' information.
Founders who are saying, okay, again, going back to that lean budget, should I invest in-house, or how do I know that I would be a good customer for Lightit? How do they make that decision?
I think both paths make a lot of sense. The good thing we have at Lightit is that we're a team of 140 people. We all have a background in health tech. We probably all faced similar challenges than the ones you're facing. We understand the industry, we understand the tech, we understand the regulations. We've integrated with the systems that you have to integrate with. So having a team that has access to all that information and background and documentation in-house can be very, very valuable and can help you build much faster and much like in a clever way, in a smart way.
And of all of your success stories, which one stands out for you?
Wow, that's a tough question. So as your audience is mostly on women's health, I will go with a women's health case study, which is Mavida Health. And it's a project I love because we worked with Mavida since day one. So they came to us with an idea. One of the founders is clinical, so she's a psychiatrist, and the other founder is a business woman. None of them had a tech background, and they were always very open and very and trusted our process and trusted that we have to make a discovery and we have to do user research, and these are the tools we're going to use. We're going to use this EHR, we're going to use these integrations, we're going to build this from scratch, but we're going to buy all of this and we're going to implement AI here. And these are the types of features that will differentiate you from anyone else, based on the user experience research that we've done. And we made that whole process with them, and we've been working with them for over 2 years. And Mavida is nowadays, it has different pieces, but at its core is a startup that focuses on maternal mental health. So it supports you during pregnancy and postpartum. You can get therapy and psychiatry through Mavida online, but it also has amazing community features and a forum. They're using AI in very innovative ways. They have a lot of content. So it's just like a 360 maternal mental health product in which you can also connect with people that are going through the same thing. And the fact that we've built everything from scratch, and the way the process have been done, in which the product keeps being more and more successful, and we're able to get more feedback and reinvest more in technology and build new features, is just like really nice to work in.
Okay, that's a terrific case study. Before I let you go, we'll put all of your resources and links in our notes. You also have a newsletter. Talk a little bit about that newsletter and what you're hoping to achieve in that.
Yeah, so we have at Lighted, we launched a newsletter called Digital Health Insider, or DHI, 2 years ago, or 3 years ago, actually. And it evolved into not only a newsletter that sends on Fridays the top news in healthcare of the week, but also we host roundtables. Actually, Mitzi, we had a roundtable around femtech probably like 2 years ago. Yes. Now we have a bunch of roundtables with very clever and qualified folks having good conversations and valuable conversations. We have articles written by leading voices, which cover really interesting topics. So it's a super helpful channel to learn about healthcare, learn about health tech and startups and innovation and funding.
What did I not ask you that you think entrepreneurs should know that are either thinking about creating something in this space or perhaps are in the midst of it and need some advice?
I'm a big community person, so I guess if you're thinking about building something in the health tech space, feel free to reach out to me, of course, but also reach out to colleagues. People are genuinely interested in entrepreneurship in healthcare. There are groups and communities where you can find peers that might want to collaborate with you or might want to give you their feedback or their input, and ask your questions, get feedback before starting to build whatever. Just have those conversations. Everything that's community-based or built by a group of people is always much, much better than just ideas or solo ideas that you might have with a bunch of personal assumptions.
Terrific. Well, Josefina Ruiz, as always, this is a great conversation. Thank you so much for being with us. I hope you enjoyed this special founder-focused segment of Beyond the Paper Gown. A huge thank you to Josefina Ruiz for pulling back the curtain on what it actually takes to build trustworthy, patient-centered digital products in women's health. If you're working on something in this space or even thinking about it, you'll find links to Josefina, Light It, and the Digital Health Insider newsletter in our show notes. And if this episode sparked an idea or gave you clarity on your next step, I'd love for you to share it with another entrepreneur or colleague in women's health. I'm Dr. Mitzi Krockover. Thank you for listening and for everything you're doing to improve women's health. Take good care. This podcast was produced by Patrick Shambayati and me, and our associate producer is Kyla McMillian.